Is the adrenal gland removed during donor surgery, and would this cause issue for a donor?
Another great question, and the answer is no. The adrenal gland is not removed. We painstakingly dissect off the adrenal gland from the kidney, leave it behind, and there are not issues with the adrenal after donation because of the fact that we do not harm it.
Okay. And what percent of donations are rejected?
Well, I think what they're asking is donors that come forward, what percentage get rejected? And that's a good question because the statistic that I like to use is that only about 25% of people that come forward to be kidney donors are accepted. So only 1 in 4. So I tell my recipients, you need to understand that statistic and try to get at least 4 people to try to come forward for you.
It's about kidney stones. I had kidney stones every 5 or 6 years or so. Wants to donate to his son who has PKD.
Yeah, that's a tough one. So what we would do at our center for someone like that is we need to find out why they're having kidney stones. So we would have them undergo a urine collection to find out what is in their urine that's causing them to have the stones. And then we would treat them for that problem. It could be that they need to avoid certain foods, they need to start on a medication, but some sort of way they would have to have a treatable cause for their kidney stones. And then we would have, if they have any residual stones, we would have those removed by the urologist, and they would have to have otherwise pristine kidney function. If all of those things were true, in other words, we found the problem, we fixed the problem, he doesn't have any other stones, and otherwise is healthy, then that person could be cleared to be a donor.
Okay. So another one is religious. Do you allow Jehovah's Witnesses to donate? Can a Jehovah's Witness donate without accepting blood?
Wow, very good question, and we've gone through that in my center. And the answer is yes. We do allow Jehovah's Witnesses to donate. They would have to have a normal blood count before the operation. They would have to agree to accept other life-saving measures other than blood transfusion. But they could donate if they had a normal blood type, they were otherwise a good donor, they accepted other life-saving measures like receiving protein in their vein. Because one of the things you could do to get the blood pressure up if someone had a low blood count is to give albumin. So if they would accept albumin, if they would accept what's called a cell saver. Cell saver is a device where if they bled during the operation, their own blood could be given back to them immediately. If they accepted things like that, then they could be donors.
Okay. Let's see. One is, they've been told that donors can no longer take NSAIDs, the medications. Is that correct?
Well, we want donors to minimize non-steroidals, NSAIDs. However, that doesn't mean that they cannot take it. We just would not want them taking those medications chronically. And by chronically, no more than once or twice a week.
Okay. Let's see. One, this is kind of, I guess, individual, but may have some generalizability here. Someone's been on dialysis for 8 years. They're 35 years old. Due to untreated, is it pruritus? I can't read that. I now have acute chronic pancreatitis and need a pancreas transplant before they will let me have a kidney. I can't get a pancreas because I'm not diabetic yet. Is that true just in Kentucky, or is that a general circumstance, would you say?
I don't think that's a general circumstance. If you have kidney disease, you should qualify to get a kidney transplant. Someone with chronic pancreatitis, which it sounds like this person has, they just need their chronic pancreatitis addressed. But if they are stable with chronic pancreatitis, and I've done patients like that, then no, they don't need a pancreas transplant, and they should qualify to get a kidney transplant.
Okay. Another is, what is the wait time for a transplant after stage 3 colon cancer is in remission? So I guess, if someone has cancer, how does that work with transplant?
Cancer can be a problem after, before you get cleared to receive a transplant. And it depends on the stage. And for stage 3 colon cancer, they would have to wait at least 2 years after being cleared. So at least 2 years, before they could undergo transplant.
Okay. Let's see. One's about scars. I've had 2 surgeries in my lower abdominal area, which probably, I guess they're major scarring. What issues can occur as it relates to the kidney surgery?
And they're wondering about being a donor? Is that it?
Yeah. Yes.
So it's always a little bit riskier to operate on people that have had prior operations. However, it's not a contraindication to being a kidney donor. So people that have had prior surgeries, including 2 surgeries, could still be cleared to be a kidney donor if otherwise they're good candidates.
There's a concern about calcification built up in veins. Is that a major concern, being qualified for transplantation?
Yeah, that is a major concern, because that happens to people after they're on dialysis, usually a long period of time. However, that is called calciphylaxis, and it is a concern. However, it is a common problem in the dialysis population, and we definitely have transplanted patients with that problem, but it has to be worked up just like any other problem. So that's what we would do at my center. We would work them up, and if they are still a good candidate, even though they have that problem, they could still get transplanted.
Okay, and final one, can you be a donor if you're anemic?
You can be a donor if you are anemic, but what we would do is we would enact treatment to try to treat the anemia. And that's usually going to mean taking folic acid, folate, and iron, and possibly even getting erythropoietin. So we have had people that have been anemic, and if it's a slight anemia, that's not a big deal. But if they have major anemia, it has to be treated and resolved before they donate.
Okay, I think we'll just leave it there. We really appreciate you doing this. We get so many questions, and we just can't get to them all in an hour. So thank you.
No problem. What a great service you guys are doing, and we are definitely happy to work with you guys on this.